The Central African Republic is a landlocked country in Central Africa. It is a small nation of a little over 5 million people. In terms of natural resources, it is among the wealthiest in the world, with steady supplies of diamonds, uranium, timber, gold, and oil. Yet, the Central African Republic remains among the world's most deprived nations. According to the CIA World Factbook, the CAR suffers from, quote, rampant poverty, human rights violations, unemployment, poor infrastructure, and a lack of security and stability. In particular, the state of education, or lack thereof, is unsettling. In 2011, education expenditures made up 1.2% of total GDP, 171st out of 173 nations. Women in particular are affected by this trend. Only a third of girls attend school, with this number dropping as they grow older. Consequently, our organization, CARE, is devoted to promoting education for both boys and girls in the Central African Republic. We ask for a $2 billion grant from the United Nations Democracy Fund to achieve our vision of equality and empowerment through education. Our vision is to see the CAR reach its full potential through promotion of universal education, a benefit to society that will result from our development plan. So, what is this plan? Our organization is devoted to promoting education for both boys and girls in the Central African Republic.
Our vision for the Central African Republic is to see a country that embraces the positive benefits, economic, social, political, and health of universal education for all men and women.
CARE partners with 3 nonprofit organizations. Each of these groups understand the importance of education to developing nations and value the role of women in society. CAMFED is our first implementation partner and is currently working with other African nations with similar education issues as the CAR. This group provides a variety of initiatives that will build off CARE's investments, including providing school supplies and tracking the progress of the individuals in the program. Our second partner is the Global Partnership for Education. Global Partnership for Education currently works with the CAR. This organization provides grants to enhance the quality of education in developing countries. Specifically in the CAR, Global Partnership for Education has provided funds for the construction of classrooms, recruitment and training of teachers, and provision of books and training materials for schools. CARE will build off the strong foundations set by GPE. Finally, CARE partners with One Girl, which is an organization that provides scholarships for African females to attend school. Partnering with One Girl will allow CARE to follow through with One Girl's initial investment by encouraging the completion of a school program. Working alongside groups with similar initiatives will help further spread CARE's message and programs.
Our organization, CARE, has 3 developmental priorities we would be working towards achieving in the Central African Republic. Our primary priority will be providing free to subsidized lunches and books for students in order to incentivize learning and attendance at school. We would then create a system to check in on the students in the primary and secondary institutions to ensure that these programs are working. We would monitor for increasing trends in literacy rates, graduation rates, and attendance rates through off-site as well as on-the-ground supervision. Our secondary priority would involve our partnering organizations. We would be establishing a solid foothold in the Central African Republic education system in order to facilitate CAMFED's introduction into the schools. CARE would also focus on integrating physical and financial resources from One Girl and Global Partnership for Education into primary and then secondary schools. Finally, our tertiary priority would be the future expansion of our organization, following the marked success of our program, and implement international workers along with the community health workers we have already. This will bring more attention to the crises of education and hunger, as well as increase the amount of public aid allowing for the increased scale of CARE.
The possible risks we face include budgeting, conflicts, transportation, child labor, security, and issues regarding the quality and quantity of teachers. For these risks, we have accumulated several mitigations. Budgeting can be mitigated through the use of government-funded grants. Issues involving conflicts can be solved through the implementation of courses on intercommunal tolerance, reconciliation, psychosocial services, and alternative education for children who had to miss much of school. The utilization of public transports can reduce issues of transportation. The use of child labor due to economic difficulty can be mitigated by providing access to free lunches, school supplies, and providing tutoring outside of school for those that cannot be present. Issues involving security can be mitigated by carpooling. The use of military jeeps to transport children can get them there quickly and safely. Issues regarding the quality and quantity of teachers can be solved by providing training for teachers and enlisting parent volunteers.
The overseeing would be done via a case study in which the education system and the improvement of the program will be tracked for 10 years. We would hire teachers, preferably female, through our partnership with the Global Partnership for Education organization. We would also ensure that children are in a class that is as homogeneous as possible in terms of age and school readiness. Students moving forward and not repeating the grade should keep the same peers in all classes and professors moving forward. Class size reduction programs will be implemented as well as more teachers are hired. These teachers would then be available for tutoring after school. Unannounced visits that monitor the teaching styles of the teachers and track how many children are in school would also be implemented. The outcome of the program will be determined by the following: the numbers of children going to school, the secondary school graduation rate, and the increasing of literary rates. Our program would collect data every semester, and data would be evaluated every year for a course of 10 years.
I care.
I care.
I care.
I care.
I care.
I care.
We care.